Fourth ventricle, overview, part of, ventricular system of the brain. Location, dorsal to the pons and upper medulla, ventral to the cerebellum. Shape, tent-shaped cavity boundaries. Floor, rhomboid fossa, formed by dorsal surfaces of the pons and medulla oblongata, contains important landmarks: median sulcus, medial eminence, facial colliculus, hypoglossal, and vagal trigones. Area postrema roof. Superiorly, superior medullary velum plus cerebellum. Inferiorly, inferior medullary velum. Also contains the choroid plexus, produces CSF, lateral walls, formed by the cerebellar peduncles, superior, middle, and inferior. Communications. Anteriorly, with the cerebral aqueduct of Sylvius. Connects to the third ventricle posteriorly, inferiorly, with the central canal of the spinal cord. Laterally, through foramina of Luschka, lateral apertures, to the subarachnoid space. Midline, through the foramen of Magendie, median aperture, to cisterna. Magna, clinical relevance, CSF flow obstruction. Here can cause hydrocephalus tumors, like medulloblastomas, may compress the ventricle. Area, postrema lacks a blood-brain barrier, important in vomiting reflex development, arises from the hindbrain, rhombencephalon, specifically forms from the metencephalon, pons cerebellum, and myelencephalon, medulla. Neuroepithelial lining develops into ependymal cells. Choroid plexus located in the inferior roof of the fourth ventricle, responsible for CSF production projects through the foramina of Luschka, visible in cadaver dissections. Important associated structures. Obex, point where the fourth ventricle narrows into the central canal. Tegmentum of pons and medulla, forms the floor, important for nuclei and pathways. Cerebellum forms the roof and is functionally related, balance, coordination, neurovascular relations. Nearby cranial nerve nuclei. CN6, abducens, CN7, facial, CN8, vestibulocochlear, CN9, 10, 12, more caudal. Lesions here can affect multiple cranial nerve functions. Radiologic appearance, MRI, CT, appears as a diamond or tent-shaped space between brainstem and cerebellum. Enlarged in obstructive hydrocephalus, mnemonic for apertures, Magendie, median Luschka, lateral,